Welcome to Raaonline. I am Dr. Jay Kumar. Today I am going to take you through on the topic skeletal muscle relaxants. So the basic competency what we are going to see here is the mechanism of action, uses and adverse effects of skeletal muscle relaxant. And so first we are going to see about the classification of skeletal muscle relaxants, how it is divided into two types and what are the drugs that comes under each types. Then we are going to see the mechanism of action of the two types which I told, peripherally acting muscle relaxants, centrally acting muscle relaxants and other things. And in peripherally acting muscle relaxant, we are going to see another two types like depolarizing agent and non-depolarizing agents, and its pharmacological effects, uses and adverse effects. And then the directly acting muscle relaxants, which is dantrolene, we are going to see about the mechanism of action in uses. And the third one is the centrally acting muscle relaxants. Okay, so these are the three different types we are going to discuss today. And finally, to sum up with the comparison and contrast between succinylcholine and D-tubercularine, which is the peripherally acting skeletal muscle relaxants, and the succinylcholine is going to be a depolarizing agent, whereas D-tubercularine is a non-depolarizing agent. So coming to the introduction, skeletal muscle relaxants are the drugs that is going to, of course, cause the muscle relaxation. But in muscle relaxation, there are two types of categories. One we can call it as a neuromuscular blockers, and second one is a spasmolytic drugs. What is the difference between these two? In neuromuscular blockers, mainly the drugs acts on a site where it interferes with the neuromuscular transmission. That means the nerve ending on the muscle fiber, that is the neuromuscular junction. So that is where the drug is going to act, and mainly it happens in the skeletal muscles and thereby leading to paralysis, which is why this particular category of neuromuscular blockers are mainly used at the time of during the surgery, any colonic abdominal surgeries or even sometimes orthopedic manipulations where they need to relax the muscles. Okay. And they don't have any CNS effects because they don't cross the central nervous system, and mainly it is used, as I said, in surgical procedures. And ICU, a few drugs has been used for when the patient is in ventilation for paralysis. So in ICU also they will use. That is the main purpose of this neuromuscular blockers. Here the skeletal muscle will be relaxed, but there is no loss of consciousness. That is the main thing here, the neuromuscular blockers. Whereas the second category, spasmolytic drugs, the name itself suggests it will remove the spasm of the muscles. Okay, so mainly that can be happening only when it is acting through the central mechanisms, where except dantrolene I have put because the dantrolene mainly it acts on the directly acting muscle relaxant. Okay, so mainly these spasmolytic drugs are used to reduce the spasticity in neurological conditions such as like cerebral palsy and sometimes in multiple sclerosis, upper motor neuron disorders, like that, where there will be the tone of the skeletal muscles will be reduced. Otherwise it will not cause paralysis or anything because it is not acting at the neuromuscular junction. Okay, so that is why it is called spasmolytic drugs. So these are the two main categories of the when you take skeletal muscle relaxants. So coming to this, the physiological aspect, the motor unit, that is the spinal cord, where the dorsal horn you have got the motor neuron cell body is here, and the nerve which is arising coming out is a motor neuron axon, and it terminates in each myofibrils. See, these are the that is the muscle fiber, and each fiber you can see here, each fiber. So there the motor neuron ends into the muscle fiber, and this junction and here they are called as the neuromuscular junction. So the motor unit forms the nerve as well as the muscle. Okay. So this is the neuromuscular junction. So once the axon terminates on the muscle fiber, okay, and this is the site where it is magnified from here. You can see that axon terminal, the synaptic cleft, and this is the muscle membrane. Okay, sarcolemma membrane, and inside you have got the cell organelles. Okay. So this is the synaptic cleft where your neurotransmitter acetylcholine is going to be released on whenever there is an impulse arising from the nerve terminal and the axon. So the acetylcholine will be released. They will be acting. If you see further, this particular thing has been magnified here, where the acetylcholine is released, and in the muscle cell membrane you have got the nicotinic cholinergic receptors. That is one of the subtypes of cholinergic receptors. One is muscarinic and another one is nicotinic. So this is a nicotinic NM receptors, we call it as, the present on the muscle membrane. So they bind to this nicotinic cholinergic receptors, and thereby further sodium ions goes inside, and it causes the action potential, the depolarization of the cell muscle membrane, and what happens? Finally, ultimately it contracts. So this is how your skeletal muscle contracts. It's a normal physiological aspect. So coming to the classification. So as I said, we can classify the skeletal muscle relaxants into peripherally acting, okay, and this peripherally acting can be divided into neuromuscular blockers, and again these neuromuscular blockers are divided into two types. One is a non-depolarizing agents and another one depolarizing agents. So the name itself suggests here depolarization. That means depolarizing agents like succinylcholine, which is commonly used in anesthetics, okay, which is a very ultra short acting muscle relaxant, and they depolarizes the cell membrane. I will tell you exactly how it happens when it comes to that particular slide, okay. So in classification, just remember the succinylcholine, which is otherwise called succinylcholine and decamethonium. Succinylcholine is commonly used for anesthetic purpose. Whereas the non-depolarizing agents, you can further subdivide it into isoquinoline derivatives as well as the steroid derivatives. So what is the thing? In isoquinoline derivatives, I will show you the structure in the next slide. We have got some examples like D-tubocurarine. So D-tubocurarine, and basically it is obtained from the plant, okay, and other things similar to that, atracurium, mivacurium, these are the drugs which they are used now. Coming to the steroid derivatives, you have got pancuronium, rocuronium, vecuronium, which is more commonly used nowadays, and so this comes under the steroid derivatives. As the name itself suggests, you will have the steroid structure in that one. So these are the two subdivisions, non-depolarizing agents and depolarizing agents. Under the neuromuscular blockers, they act on the peripheral muscle